And from here I am going to Parma, where we have the 5th Ministerial Conference in Europe between Ministers of Health and Environment. It's an excellent process, very beneficial for the whole of the region, and I would like us to explore in which other areas we should have similar processes, like for example with Ministers of Education or other areas. I want to renew the European health policy as a common European vision, which will provide an inspiration and policy guidance for member states, partners, public health organizations and professionals. At the same time, it will also seriously address social inequalities and their impact on health. I strongly believe that if we are to make progress to control the NCD epidemic in Europe, we have to make a serious approach to link the social inequities, social determinants and the NCD issues, because otherwise we will not be successful to push back this disease burden. I also want us to see a health policy which drives action to improve the negative impacts of health determinants and which helps us to earn the public health leadership that will benefit us all. And here I would like to underline again that leadership has to be earned and deserved. It is not given just by the Constitution, and every day we have to work for that. And for me, the success of the policy will be if I see health as a governmental responsibility, like you do it here in Portugal, where every minister is a health minister in his or her own sector. And this is an outcome of the Oslo meeting that we had last year on the financial sustainability. But I believe in this last statement, and I strongly believe that we have to move into this direction. And sometimes it seems as a dream or a nice vision, but we need to have dreams and visions. Why do we need a European health policy when there are so many policies and strategies around? We need it because we still need a comprehensive, integrative and balanced common policy and strategy for the WHO European region, a policy that can address the challenges and opportunities of Europe's changing landscape. And we have a lot to build on in the European region, both the Health for All policies, the Health 21, and all the Health in All initiatives that has enhanced intersectoral awareness and action. So what I would like to see is a health system approach, a renewed commitment to public health, and the new European health policy, which have to go hand in hand. The new European health policy will reinforce commitments to health system priority issues. It will provide an effective vehicle for strengthening and extending the stewardship function of the health system in terms of reaching out to other policy sectors for better health outcomes. It will support a patient-centered approach that values and promotes citizen participation and community empowerment. And it will add practical content and stronger focus on public health services, public health functions and public health training. And with this approach, I would also like to involve very actively the national public health institutions, the schools of public health, and I see my colleagues here in front of me, and I'm looking at them for a very strong and very close partnership, because I strongly believe that WHO needs to have institutional basis also in the member states, beyond the ministries of health, public health institutions, schools of public health, but also the other sectors, obviously. So what is it that the new European health policy should achieve? It should inspire, it should guide action, be accountable, integrate, lead and catalyze a developmental process. It will inspire by the promotion of transformational values, and the financial crisis has opened a new opportunity to re-examine the role of health and also to reaffirm the core values. And that is what I think we should do. There is a lot to build on. Some of you may recall the pioneering Health for All strategy of 1984, when in the foreword, Dr. Joe Aswal, who unfortunately passed away in recent weeks, he said that this policy is a blend of today's reality and tomorrow's dreams. And he also said that it succeeded simply because its ideas proved to be sensible, practical, and above all capable of inspiring people to think afresh, to take new initiatives, and to work together in new ways. The new health policy and strategy will also provide us a framework, and it will help us to identify and address key challenges and priorities. It will identify ways on how to effectively deal with the social determinants and address health inequalities at all levels. But at the same time, it will also identify and address the impact of major developments that drive societies on health, as well as the contribution of health to these developments. As part of this updated or new European health policy, I would like to initiate a European study on social determinants led by Professor Michael Marmot. This will build clearly on the work of the Global Commission, but also on the many good work that are around in Europe, and we are pulling this information together. But this will specifically address those issues that are specific to the European region, like this huge health divide that we have in Europe, that the Tajik population now live 18 years less than population in the western part of the region. That is one of the issues. But the other issue is the whole social gradient that we have to address and build into the new updated policy. And most importantly, this European study on social determinants will translate its findings into policy proposals and practical guidance, both for capacity building and for implementation in the member states. The new European policy will also help with accountability by providing instruments for transparency, and it will help us with an integrated approach to move beyond silos and strengthen partnerships and intersectoral working. It will also help us to catalyze and lead, and public health development process will clearly be a very important supporter here. Now, let me just give you show you on one slide that the European region has a huge experience in policy and strategy developments. Many of you who are sitting in this room are fully aware of this. We have a 30 years of tradition to develop European policies and strategies. We started in Alma-Ata. The last one was the Tallinn Charter, and according to a regional committee resolution, I am supposed to have an updated health policy by 2013, but I would like to speed up that process and get the mandate from the regional committee this year to send an updated health policy with a participatory approach like you have here in this room today, also at the European level, to take it to the regional committee next year in 2011.